Multiple choice questions, MCQs, on the topic of deaf-blindness, focusing on its causes, characteristics, communication methods, educational strategies, and support systems. 1. What does deaf-blindness refer to? A. A condition of complete paralysis. B. A combination of hearing and visual impairments. C. Only loss of speech. D. A mental illness. Answer: B. A combination of hearing and visual impairments. 2. Which is the most common communication barrier faced by individuals with deaf-blindness? A. Poor memory. B. Lack of mobility. C. Difficulty in seeing and hearing simultaneously. D. Hyperactivity. Answer: C. Difficulty in seeing and hearing simultaneously. 3. Deaf-blindness is classified as A. Single disability. B. Temporary illness. C. Multiple disability. D. Sensory overload. Answer: C. Multiple disability. 4. One major challenge in teaching children with deaf-blindness is A. Inability to walk. B. Verbal aggression. C. Lack of sensory input. D. Excessive mobility. Answer: C. Lack of sensory input. 5. A common cause of congenital deaf-blindness is A. Head injury. B. Usher syndrome. C. Malnutrition. D. Emotional trauma. Answer: B. Usher syndrome. 6. Deaf-blind children often require A. Medication. B. Intensive behavior therapy. C. Individualized communication strategies. D. Frequent hospitalizations. Answer: C. Individualized communication strategies. 7. A communication method used for deaf-blind individuals is A. Oral reading. B. Braille. C. Morse code. D. Flashcards. Answer: B. Braille. 8. One of the earliest interventions for children with deaf-blindness should focus on A. Learning computers. B. Sign language and tactile input. C. Mathematics skills. D. Physical training. Answer: B. Sign language and tactile input. 9. What is tactile sign language? A. Language using foot movements. B. Language based on pictures. C. Signs communicated through touch. D. Written words in large print. Answer: C. Signs communicated through touch. 10. Which law in India recognizes deaf-blindness as a category of disability? A. RTE Act. B. POCSO Act. C. RPWD Act 2016. D. JJ Act. Answer: C. RPWD Act 2016. 11. The role of an intervener is to A. Teach Braille. B. Interpret for a deaf-blind person. C. Provide food and clothing. D. Diagnose diseases. Answer: B. Interpret for a deaf-blind person. 12. One assistive device commonly used by deaf-blind individuals is A. Talking calculator. B. Tactile watch. C. Hearing aid only. D. Whiteboard. Answer: B. Tactile watch. 13. Which of the following is a sensory disability? A. Autism. B. Visual impairment. C. Cerebral palsy. D. ADHD. Answer: B. Visual impairment. 14. The condition in which a child is born deaf and later loses vision is typically called A. Acquired deafness. B. Congenital blindness. C. Progressive deaf-blindness. D. None of the above. Answer: C. Progressive deaf-blindness. 15. One of the primary goals in teaching a child with deaf-blindness is A. Physical strength. B. Speed reading. C. Functional communication. D. Drawing skills. Answer: C. Functional communication. 16. The largest NGO working for deaf-blind persons in India is A. Sight Savers. B. NAB. C. Sense International India. D. Save the Children. Answer: C. Sense International India. 17. What type of curriculum is most suitable for deaf-blind learners? A. General syllabus. B. Online only program. C. Individualized education plan, IEP. D. Vocational only. Answer: C. Individualized education plan, IEP. 18. Which approach is commonly used to teach daily living skills to deafblind individuals? A. Lecture method. B. Rote learning. C. Hands-on and modeling. D. Visual presentation. Answer: C. Hands-on and modeling. 19. Which sense is usually enhanced in persons with deafblindness for learning? A. Smell. B. Taste. C. Touch. D. Vision. Answer: C. Touch. 20. The communication method that involves pressing symbols into a palm is called A. Braille typing. B. Tactile finger spelling. C. Handwriting. D. Text messaging. Answer: B. Tactile finger spelling. 21. Deafblindness affects which domains of development the most? A. Emotional and social. B. Intellectual and physical. C. Sensory, communication, and mobility. D. Only academic. Answer: C. Sensory, communication, and mobility. 22. A major challenge in assessment of deafblind children is A. Financial constraint. B. Parental involvement. C. Sensory access to tests. D. Lack of curriculum. Answer: C. Sensory access to tests. 23. An effective early intervention strategy includes A. Group games. B. Tactile exploration and routine buildings. C. Textbook distribution. D. E-learning. Answer: B. Tactile exploration and routine building. 24. The teacher of a deafblind child must focus primarily on A. Competitive exams. B. Career planning. C. Multisensory teaching. D. Homework. Answer: C. Multisensory teaching. 25. A student with deafblindness may need to learn through A. Watching YouTube videos. B. Reading aloud. C. Touch and movement-based experiences. D. Group instructions. Answer: C. Touch and movement-based experiences. 26. Which of the following can be used for mobility training in deafblindness? A. GPS watch. B. White cane. C. iPad. D. Sunglasses. Answer: B. White cane. 27. A student with dual sensory loss is most likely to need A. One-to-one instruction. B. Group activities only. C. Peer tutoring. D. Loud audio instructions. Answer: A. One-to-one instruction. 28. A primary caregiver of a deafblind child should be trained in A. Typing skills. B. Lip reading. C. Tactile communication methods. D. Speech therapy. Answer: C. Tactile communication methods. 29. Learning goals for deafblind children should focus on A. Entertainment. B. Memorization. C. Independence and communication. D. Speed and accuracy. Answer: C. Independence and communication. 30. Which therapy can be helpful for deafblind children? A. Light therapy. B. Audio therapy. C. Occupational therapy. D. Aromatherapy. Answer: C. Occupational therapy. 31. Which document outlines personalized support for students with disabilities? A. Student diary. B. Progress card. C. Individualized education plan (IEP). D. Admit card. Answer: C. Individualized education plan (IEP). 32. A deafblind child communicating through object symbols is using A. Augmented communication. B. Visual symbols. C. Morse code. D. Speech. Answer: A. Augmented communication. 33. What does congenital deafblindness mean? A. Developed after age 1. O. B. Occurred due to accident. C. Present from birth. D. Caused by fever. Answer: C. Present from birth. 34. Which of the following is most critical for the emotional development of a deafblind child? A. Classroom seating. B. Attachment with caregiver. C. Frequent discipline. D. Internet access. Answer: B. Attachment with caregiver. 35. A deafblind person can understand concepts best through A. Abstract lectures. B. Real and concrete experiences. C. Audio stories. D. Complex texts. Answer: B. Real and concrete experiences. 36. Transition planning for deaf-blind youth focuses on A. Games and hobbies. B. Higher education only. C. Life skills, work readiness, and independent living. D. School uniform. Answer: C. Life skills, work readiness, and independent living. 37. How can we ensure safety of a deaf-blind child in school? A. By using bright lights. B. By giving a buddy system and tactile cues. C. By ignoring physical contact. D. By shouting instructions. Answer: B. By giving a buddy system and tactile cues. 38. What is the best method to develop trust with a deaf-blind child? A. Surprise rewards. B. Physical punishment. C. Consistent routines and touch. D. Ignoring responses. Answer: C. Consistent routines and touch. 39. A deaf-blind learner may respond better to A.